This is the gentleman from North Carolina, Mr. Pittenger, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I was frankly disappointed, really perplexed yesterday when the President of the United States called a meeting in the White House and asked the Speaker of the House to come to meet, asked the leader of the Democrat in the House to come and meet, asked the Majority Leader in the Senate to meet. At the same time, his press man, Jay Carney, was on TV saying, you know, we're not going to negotiate. When they ended the meeting, Senator Reid, Ms. Pelosi said, we're not going to negotiate. You know, Mr. Speaker, I'm aware that this bill has been 50 years in the making. The Democrats have wanted to nationalize health care for 50 years. They found their political timing to do it when they controlled the House and the Senate, when President Obama was president, and with a total partisan vote, they got what they wanted. Not even reading the bill. As Ms. Pelosi said, we're going to pass it, then we're going to read it. Yet Mr. Obama has said that House Republicans are on an ideological crusade, Mr. Speaker. His staff have referred to us as suicide bombers. Really? You know, Mr. Speaker, we were all elected to serve our constituents. The President was, and so was I. So was the Speaker of the House. We don't have a monarch in this country, Mr. Speaker. We have a representative government. And our role is to listen and to respond to our constituents. They are writing us, they're emailing us constantly, telling us their concerns. Let's hear about one from Cornelius, North Carolina. I just received my new monthly premium from Blue Cross Blue Shield of North Carolina for 2014. With the Obamacare monthly cost now has tripled with limited coverage. But what the heck? Now I can get pregnant at 58 years old, and I can, because I have my mandatory maternity coverage. Please continue to push to stop this horrible mandate. Here's another constituent from Huntersville, North Carolina. We're currently paying $270 a month for our high deductible health insurance policy through Blue Cross Blue Shield. Today, however, we received our new rate for our family. For 2014, a comparable plan now with Blue Cross Blue Shield is $1,037.02. Mr. Speaker, this is deplorable. She goes on to write, it is my understanding that under Obamacare, premiums would go down. It was my understanding that this would be good for everyone. If Obamacare is not good enough for government employees, like members of Congress and the White House, why is it being delayed for certain corporations and labor unions are asking for an exemption? And why can't I get out of this program? She goes on to write, I'm asking you to stand up for freedom, for choice, for the citizens of this country, to delay Obamacare for at least a year. At the very minimum, or even better, to repeal the law in its entirety. Mr. Speaker, this is not an ideological crusade. This is about meeting the needs of our constituents. There are other concerns out there with jobs. Companies aren't hiring full-time people. They're hiring part-time so they can stay under that threshold. The cost of this health care plan has gone up dramatically. The CBO, the Congressional Budget Office, says it's unsustainable. Why should we allow for corporations, there's 1,100 of them today, friends of the President, to receive a delay in Obamacare? And yet, ordinary Americans cannot do that. That's why we proposed an amendment for an for individual mandate deferment, that they would not have to be obligated at this time. We also said that members of Congress should not receive the subsidy, nor should the White House staff, the President, his cabinet secretaries. Why should we get something special? that the ordinary American people don't get. And yet, these bills are lying on the desk of Harry Reid because he tabled them. Mr. Speaker, it is time to bring sound reasoning to this process. Let's meet and negotiate, Mr. President and Senator Reid. Thank you.